Dame Elizabeth Anionwu, pleasure to speak to you this afternoon. Thank you for joining us here on Sky News. Dame Elizabeth was at that service of thanks in Westminster Abbey a little earlier this morning. Well, joining me now, Dr. Rahim Kanji, a consultant cardiologist here at West Middlesex University Hospital. And thank you for taking the time to come and see us. Very busy hospital today. We've managed to find a quiet space. Celebrating the 75th anniversary, but as we've been experiencing at the hospital today, work very much continues, very little time for celebration. You're tackling, what you have to deal with patient-wise and challenge-wise. How are you reflecting on the 75th anniversary of the NHS today?
So yes, of course, there are challenges that we face currently and that we will face in the years to come, but it's important to reflect upon the achievements that we have made over the past 75 years, of which there are many. We started off as an institution mainly focusing on dealing with communicable diseases, infections, injuries post-World War phase. And currently today, the exact opposite. We're focusing on non-communicable diseases. And that journey has been fantastic, the way we've adapted to meet the needs of our community. I'd like to share a couple of personal highlights for me, and they include the vaccination programme for children, trying to rid or at least minimise the disruption caused by measles, mumps, rubella, polio, and of course the way we managed and dealt with the COVID-19 pandemic, the way we came together, the camaraderie, the selflessness, the innovation, the care that we provided in a very effective, unprecedented manner. So I think it's a time to, yes, have some concern about the challenges that we face currently and are due to come, but also time to reflect and say, yeah, we've done very well, and that should provide the impetus to carry on. Yeah,
to continue doing that good work and to advance the NHS, to keep it going, because of course the big question today is, you're marking 75 years, will it make it to 100? And this open letter that's been issued today by 3 leading charities is calling for almost, cross-party support in terms of whoever the government may be today or in the future. There needs to be a continuous long-term plan. The attention has been for too long on short-term solutions, headline grabbing policies. The government, the Prime Minister just last week announcing that, he was going to try and halve medical degrees, introduce apprenticeships, which grabs the headline. Whether they can work or not remains to be seen. Is that something you'd like to see in terms of, putting aside party political differences, it not being a political football anymore, and everybody getting on board to secure the future of the NHS?
I totally agree. I think we all have a common goal, everybody in the NHS and hopefully government, that we want to provide safe, effective care that obviously will last and be able to provide that care in 25 years and hopefully 75 years as well. And I think you're quite right. Changing policies every 4 years when a new government comes into place isn't perhaps the right thing. And having a goal, a common goal, that everyone, government, NHS and members of the public can work towards is the right thing to try and achieve and do. And I think currently right now, I'm sure this fact has been thrown around, that 1 in 5 of us are over the age of 65 or 65, and that number is only going to increase. We do have an ageing population, and with that will come challenges, specifically management of degenerative conditions. So there really needs to be a plan on how to focus on management of those patients and that population. And that probably inevitably is going to require more input with social care, more input with dementia management, more input with cardiovascular services such as heart failure, such as arrhythmias, such as myocardial infarction. And I think us as a trust have tried to embark on that journey by coming about with a novel, innovative strategy, being virtual wards, virtual hospitals, whereby we acknowledge that there are a cohort of patients who don't quite meet criteria to be admitted to hospital and managed in hospitals, but also need more than just seeing the GP every month or so. And for that cohort, we admit them onto a virtual ward, a virtual hospital, if you will. And they are given the tools to monitor their condition, blood pressure machines, heart rate monitors, rhythm monitors, and are spoken to on a daily basis by a specialist nurse who then consults with us. That allows us to both manage the patient, keep them in the community, keep them symptom-free, improve their quality of life, but also reduce the admissions to hospital, which we know are costly and have an impact on mortality.
Yeah, you make two good points there. Something, again, that's been brought up in that open letter today, the overall health of the nation, and, of course, the investment in social care, because, of course, you know, hospitals and social care go hand in hand, and they can't operate effectively without the other. Dr. Rahim Kanji, thank you so much for taking the time to come and talk to us here on Sky News today. We'll let you get back to your day job.
Thank you.
Thank you so much.